Good day. This briefing aims to summarize key developments in regards to COVID-19 mitigation work nationwide, as well as other recent related issues. It is to be recalled that with the COVID-19 pandemic, worldwide governments have been enacting various measures to contain the spread of the virus within their own contexts, and to also ensure that they minimize the devastation of this health crisis. Similarly, in Ethiopia, the COVID-19 Ministerial Committee has been established and enacting various measures, including much recently the decreeing of national state of emergency. Considering the severity of the virus, not only on our health systems, but also the economic impact and consequences that will subsequently proceed, the focus and priority in the past 2 months for the federal government has shifted to mitigating the spread, responding to active cases, ensuring preparedness for extreme eventualities, and overall strategizing to withstand the adverse effects on livelihoods. It is to be recalled that the country was scheduled to hold national elections in August 2020, or the end of August 2020. This was a much anticipated election period following a series of reforms that have been taken over the past 2 years towards Ethiopia's democratization process and journey. Nevertheless, the disruptive nature of COVID-19 pandemic has interrupted the capacity for effective and timely organization of the scheduled elections, as a thought put forth by the National Electoral Board of Ethiopia. The focus of the government has also been in adequately responding to and diverting full energy and resources to the challenges we are confronted with at the moment, particularly as Ethiopia may still be in the very early stages of the spread of the virus. In light of this, and considering the preparation challenges that the National Electoral Board of Ethiopia had put forth, as well as the term limit of the House of People's Representatives coming to an end around the end of September, the government began a series of consultations with the legal scholars, researchers, and experts over the past few weeks. These legal experts, scholars, and researchers are based within the country as well as outside of the country. This consultation process has been to solicit constitutional responsive solutions to the disruption of the elections caused by the COVID-19 health emergency. These consultations for sound options have been premised on ensuring options proposed are in line with 8 particular important factors. Number 1, that it is constitutional, whatever decision is taken or whatever option is taken is constitutional. Secondly, that it ensures government continuity. Number 3, that it will not deter the efforts that have been begun in responding adequately to the COVID-19 health crisis. Number 4, that the options taken will enable the conduct of free and fair elections. Number 5, that it will also develop constitutional order. Number 6, that the options will be morally and politically legitimate. Number 7, that it will be efficient. And finally, number 8, that it has national applicability, and that the federal government as well as regional governments will be able to apply it within their constitutional frameworks. Accordingly, the more than 50 legal scholars, experts, and researchers tasked to propose solutions drew 4 constitutional sound options, which in no particular order are: number 1, the dissolution of the House of People's Representatives; number 2, conducting the elections during the state of emergency period; number 3, constitutional amendment; and number 4, constitutional interpretation. Each of these options have been weighed and have been presented with regards to the pros and cons, and they have been discussed in consultation with competing political parties as well. It's to be recalled that this habit of consulting competing political parties on national issues had also been demonstrated throughout the 2-year political reform process, but also recently with the enactment of the state of emergency health crisis, the Prime Minister had convened political parties to confer and solicit their inputs with regards to the need, the scope of a state of emergency in response to the COVID-19 health crisis. So as we all know, the House of People's Representatives recently endorsed the motion put forth by the National Electoral Board of Ethiopia to postpone the elections. and resultantly based on the legally and constitutionally sound options proposed, the House will frame these options and send their recommendations to the Council of Constitutional Inquiry as an ongoing process. I would like to give a little bit of an update with regards to the progress that is being undertaken by the COVID-19 Ministerial Committee. So the COVID-19 Ministerial Committee that is being chaired by the Prime Minister has been meeting regularly to evaluate the threat levels of COVID-19 within the country, as well as commensurate measures that have been undertaken, as well as the activities that each of the subcommittees under the Ministerial Committee has been tasked with. So the following points reflect key milestones from meetings that were held yesterday by the Ministerial Committee. So as of this morning, the number of positive cases remains at 133, with 66 in recovery reported by the Ministry of Health. And the focus has also continued on increasing the testing capacities, as well as contact tracing of up to totals of 40 to 50 individuals that are suspected to have come within the vicinity or in close proximity with positive cases. So far, nationally, 24 testing laboratories have been set up, and at maximum capacity, these laboratories can undertake 5,600 tests per day. Nevertheless, one of the key challenges that has been cited by the Ministry of Health in increasing the daily testing capacity has been sample collection kit shortages encountered at the moment, but this is also being addressed through procurement processes and also in consultation with international partners. The Ministry of Health has also been undertaking extensive pre-screening efforts at the national level. Up to 3.6 million households are reported to have undergone pre-screening for symptoms, with suspected symptoms being connected with rapid response teams in each of their locales. As well, treatment centers are being sufficiently reinforced. One of the largest treatment centers that has been set up recently is within the Millennium Hall, with a capacity of 1,000 patients, or able to accommodate up to 1,000 patients. And this is currently being further reinforced with the required material and equipments, including ventilators, and it should be going into operation soon. Similarly, various medical supplies and equipment like protective equipments and procurement of other medical supplies is currently underway, including from manufacturers who have shifted their manufacturing lines to respond to what is needed at the moment. From the economic perspective, considering that the health crisis will have grave impacts on the economy, through the efforts of the Macroeconomic Committee, an economic response plan has also been designed, and this has been designed to ensure the health of the macroeconomic environment, to ensure that the nation has got adequate foreign currency reserves, and also to support companies from ceasing operations, as well as supporting them in their recovery period. In addition to budgetary shifts that had been made to allocate 15 billion birr for the COVID-19 response, fund mobilization work is also being undertaken by the Macroeconomic Committee with international partners to fulfill the estimated needs in order to tide Ethiopia over the health crisis. So just this Thursday, the board of the International Monetary Fund approved a highly needed financing of USD 411 million under the fund's rapid financing instrument. Additionally, financing for budgetary support is currently also being sought from international partners. And to provide cushioning for COVID-19 affected sectors such as the service sector, manufacturing, construction, wholesale trade, and others, the government is also enabling targeted tax remittances so these sectors can continue without the added burden. Other measures that have been drawn, again, by the Macroeconomic Committee to alleviate some economic shocks is, in addition to extending the payment timeframes of value-added tax and turnover tax for the private sector, companies that have pledged monetary support to the National Resource Mobilization Initiative are eligible to have 20% tax deductions from their annual reporting. Continuing onwards, for manufacturing companies that have been faced with tangible export challenges related to COVID-19, permit is also granted to sell their goods within the country. through the National Bank of Ethiopia and the Development Bank of Ethiopia, up to 4.5 billion birr liquidity injection is also being facilitated for cooperatives, small and medium enterprises, as well as microfinance institutions. And also businesses that have provided a minimum of 2 months rental relief for their tenants will also be granted a 1-year rental income tax relief. Furthermore, businesses in the hospitality industry, educational institutions, and other businesses that are not able to operate at optimal levels because of the COVID-19 health crisis and yet have kept their employees on payroll have been given relief of 4 months employee income tax. So with such financial support measures that have been drawn, the Macroeconomic Committee is also in the process of transitioning from its focus on holistic support, which has been ongoing for the past 2 months, now to targeted specific sector support, particularly as the hotel and tourism sectors are suffering. With regards to the National Resource Mobilization Subcommittee, which has been effective in garnering support of citizens throughout the country. It has successfully mobilized up to 1.7 billion birr so far, for as well as in-kind contributions. 1.7 billion birr plus in-kind contributions as well. And this is also for the purposes of extreme eventualities that we are preparing in case the COVID-19 health crisis intensifies in the country. Additionally, food stockpile efforts and distribution systems and protocols are currently being set up considering the food insecurity challenges that COVID-19 is also expected to pose within the country. And in addition, the subcommittee is also facilitating voluntary services, including online trainings for up to 116,000 registered youth. So there is a lot of mobilization and goodwill that the federal government is quite appreciative of that is happening at a national level. Just to give you a snapshot also of what the ICT subcommittee has recently achieved as a key milestone. Initially, it had targeted up to 176 services or government services to go online through 34 institutions. So far, it has enabled 70 government services to go online through 10 of these institutions. And the work to bring on board the remaining institutions and services is also proceeding. So while these are snapshots of what is being undertaken at a national level, the Prime Minister further reiterates that people should not become complacent in prevention measures. As progression of the virus within the country, it's still at the early stages, so the complacency should not be tied to any reports or zero reports that may emerge every so often. We still encourage citizens to be adequately prepared to ensure that they're following the prevention and mitigation guidelines as established by the Ministry of Health and the Ethiopian Public Health Institute, and to continue the various efforts that have been begun, because we're not sure when this would intensify and when the COVID-19 health crisis will end. So it's important to always be on guard and fully prepared. I will come back at other points in time with further updates. Thank you for now.